Imagine a situation where you can hear things that no one hears, isolated, separated from others. This is in real what happens to schizophrenic patients. Hi everyone, I'm Blessy Thomas, clinical pharmacist from Shalom Institute of Mental Health and Research. As we know, our brain are controlled by tiny chemical messengers that balances emotions, perceptions, how we think. Then this delicate balance between the chemical messengers, especially dopamine, gets disrupted. The brain fails to identify what the reality and illusion is. This is what really happens to a schizophrenic patient. When the level of dopamine are elevated, the patient starts to show symptoms like hallucination, delusion, which are called positive symptoms. On the other hand, in some patients, the level of dopamines are reduced. That induces negative symptoms like lack of motivation. Even some patients fail to express their emotion. Some get socially withdrawn. But how can we manage these symptoms? Here is where the role of medications pop in the management of schizophrenia. The schizophrenic medications are generally classified into two categories, that is typical antipsychotic agents and atypical antipsychotic agents. First generation antipsychotic agents are medications that specifically blocks dopamine receptor, that is D2 receptor. Examples of some medications are haloperidol, chlorpromazine, etc. However, these medications were found to induce movement-related disorders in few patients, such as dystonia, tremors, etc. After several research, trials and errors and efforts, the researchers could develop second-generation antipsychotic medications that not only control the positive symptoms but also manages or overrules these side effects. The second-generation antipsychotic medications not only block dopamine receptor but also block serotonin receptors that effectively manage the negative symptoms, and also in some patients the cognitive functions were found to be very high. The example of these medications are clozapine, risperidone, quetiapine, etc. In certain patients, it was found that medication adherence are very low. So in order to prevent such cases, long-acting injectables like palperidone were also developed that release the medications part by part as sustained release medications. Along with medications, counseling, rehabilitations and family support are very essential for the recovery of such patients. In our hospital, we have witnessed several lives transform beautifully. Patients living in the shadow of schizophrenia transforming again happily into their life, embracing beautifully and reaching into heights that we never expected. Once they get a proper treatment, schizophrenia is always on this World Schizophrenia Day. Let's break the stigma, spread awareness and support mental health for all. Thank you.